Hello, and welcome to Live with MainStreet. We have Cynthia Flanagan and Jim Ludwig on
Hi, everybody.
the webinar right now, and we'll be talking about retirement. We've got a couple things to discuss. Jim will be discussing the getting ready for retirement during the last 3 years or sooner, and I will be talking about long-term care insurance. Jim, would you like to start?
Great. Thank you, Cynthia. Hello, everyone. Thanks for joining us. We'll be able to answer any questions either remotely or in the Q&A box if you're listening to us live. Let's start right now. And Cynthia, I wanted to share with our listeners and viewers sort of a quick checklist on getting ready for retirement. We're financial planners, and doing a budget is important, and having a retirement budget is even more important. And of course, when we do financial plans for people, that's one of the things that we focus on first. And Stephen Covey, who wrote that book, The 7 Habits of Highly Effective People, one of those goals was begin with the end in mind, and knowing your retirement budget is the end result in that target we're going to look for. People should also know when and how they're going to take their Social Security. If they're married, sometimes there's one takes it early, one takes it delayed, both take it on time. There's numerous strategies on Social Security, and people should understand what the short-term and long-term implications are, because many times when we're doing financial plans, the difference could be $150,000 difference over a lifetime. So knowing your Social Security strategy is important. In the soft areas of planning for retirement is know what you're going to do with your free time. Are you going to play golf and tennis all the time? Or are you going to get bored with that? Developing new hobbies or renewing old hobbies is a good thing to be planning ahead for. Maybe you want to take some classes to get up to date on that old hobby. I've been doing that myself. And it's a good preparation for retirement. Having an emergency fund ready is always important, no matter if you're young or getting ready for retirement and you're middle-aged or a little bit later. We want folks to know that their planning documents for death or disability are in order. We call that estate planning. That's usually the will, the durable power of attorney, might be a living trust. In many states, that helps people avoid lengthy probate. Getting that in order is important. No one should want really to leave a mess for other people to clean up. Health care, whether it's by Medicare or private insurance, supplemental plans, Medicare Advantage. There are a lot of options as people get ready for retirement, depending on their age, and knocking down that health care, the cost and how you're going to have it provided is really important. Housing, stay or move. Are you going to get tired of walking up and down stairs? Is your house situated in an area where you're close to healthcare? Is the inside of your house modified for someone that might have mobility problems? All those housing questions need to be resolved as soon as you possibly can, and relying on adult children to be in the neighborhood sometimes is a false sense of security. You know what? They up and move. Can you imagine that? Well, it could happen. So making housing arrangements is really important as you get ready for retirement. Now, on the fun side, develop that travel bucket list. Just today, I was talking to my wife, trying to confirm that she wants to take that train across Canada from east to west or west to east. And I thought that was on her bucket list, and it turns out it's not. So having those discussions to make sure that you know how you're going to spend those travel dollars, how much they're going to be, is a really fruitful exercise. And some people don't want to just stop working altogether. Some people work part-time because the organization they're retiring from would like to have their corporate memory and have them back at least 1, 2, 3 days a week, or for a project that might last a month or two. And in our experience, that helps fund extra travel that people weren't counting on because they got a nice chunk of change from a part-time job. Also, some people in our society these days are already doing side gigs, and maybe they want to continue that in retirement. So exploring side gigs or part-time work is really good. So Cynthia, those are the bullet points that I wanted to share with people. And lastly, very quickly, because I know this is hard to read, we at MainStreet have developed a 3-year chart on what to do. And hopefully our audience can see the topics that we're going to talk about on the left-hand side here. One of the biggest questions we always deal with right before people get ready to retire is, where am I going to take the money from? Is it going to support my budget? Do I know what to do on health care? How about asset allocation? How much risk do we want to take with our stock and bond portfolios? The housing decisions we just covered, travel, working in retirement, and Social Security. So I mentioned all those things in a bullet point. As you can see, as I go across the bottom, we're starting with 3 years out, then 2 years out, 1 year out, 6 months out, 90 days out, 45 days out, and retirement. So we have this little chart. It doesn't apply exactly the same for everybody, but Cynthia, it will help people periodically look at how they're doing and making sure they're ready for that next phase. There you go.
That's terrific. Thank you, Jim. I like all the bullet points and mapping it all out in that chart. And your one bullet point about healthcare planning, that really relates to the question that I got sent, and that is, should I be considering long-term care insurance? As you would imagine, long-term care costs are expensive. And in fact, Genworth has a 2018 survey on long-term care costs that indicate that the national median cost for a private room in a nursing home is $100,375 annually. Assisted living, the national median, that is $48,000 a year, and the national median for home health aides providing help for 44 hours a week is $50,336 a year. So that's kind of expensive there. And that's also why it's an important part of your retirement planning to try to figure out how you're going to pay for it. Now, if you're wealthy and you have assets, you could self-insure. If you don't have a lot of assets at all, a little bit more impoverished, and you have the level of assets that qualify for Medicaid, then you may rely on Medicaid. But for everyone else in the middle, then you have to really consider your options. And one of the options is long-term care insurance. Now, the insurance is expensive and may run a few thousand to several $1,000s a year in premiums. The actual cost does depend on your age, your gender, where you're living, how much coverage you'll get, and your current health. A good age to start thinking about whether you want to look into or whether to get long-term care insurance is about 50. So that's a good opportunity to do some research and look out where you might be living either in retirement or where you'll be living currently, and get an idea of what those kind of costs would be. And also what kind of life you might want to live in retirement or as an assisted living, if you needed assisted living as well, whether you wanted to have it in an assisted living facility, a nursing home, have people come to your house. This is a good time to start thinking about it. That way, when you go to a calculator, such as Genworth.com has a premium calculator to give you estimates, then you can have a rough idea of how much everything would cost. Or better yet, when you're ready to really start thinking about how much everything costs, talk to an actual long-term healthcare specialist, and they can give you an estimate based on your actual information. And they can also look over across a number of different providers to get you the best rate as well. And the younger you are, the lower the premiums would be, but you may also be paying premiums for a long time before you'd actually need it. So maybe around your early 60s might be a good thought of when you'd want to actually purchase them. That is assuming that you haven't actually gotten a health issue that may have prevented you from getting the long-term health care in the first place. No one has a crystal ball, but you can try to gauge it a little bit, thinking about your family history as well as your current health. Regarding your family history, you might want to think if your family has a history of strokes or Alzheimer's or other genetic conditions that you might have inherited that might cause some impact on your activities of daily living. So when you actually get your long-term health care from your insurance, it has to impact at least 2 of the 6 activities of daily living, which is eating, bathing, dressing, transferring, so from a bed, in and out of a bed or in and out of a chair, or toileting or continence. So have to keep those ones in mind. And you do have to remember that Medicare is not going to cover long-term health costs. It will cover some skilled nursing care, but only for a short period of time. And similarly, your current health care, what you get through your employer, is unlikely to cover long-term costs. And again, this is why we're planning for this. One thing that long-term care insurance can provide for you is peace of mind. Peace of mind that you don't have all of your assets dwindling by the time your spouse may need assets to live in retirement as well. This would apply particularly if one spouse needs long-term care and one spouse is healthy and then just needs the rest of it to complete his or her retirement. I think that one thing that prevents most people from considering long-term care, not other than just the high cost of it, is that for a typical long-term care policy, neither you nor your heirs would be able to get any of the premiums that you put in back when you've passed. And so that might be a barrier preventing you from thinking about long-term care coverage. So certainly nobody wants to get sick or be incapacitated in any way, but if you or your spouse or your parents needed long-term care insurance or needed the long-term care provided by the insurance, you'd be glad that you would have planned for it in advance. Now, like most insurance, this is definitely not one that you want to take advantage of. Hopefully, you'll just live a long life and never need it at all. But it would be there if you do. And whether you wanted to get the long-term care insurance to cover your long-term care needs or you're going to self-fund, those are questions that you'll need to look through and discuss. And us as financial planners are here to help put it into your retirement plan so you can actually plan for it. So that is the answer to that question. And that'll do it for us at Live with Main Street. And I hope everyone has a great weekend. Bye.
Bye.